Courageous Doctors is a newscast about healthcare topics of concern to everyone. From health and safety tips, to recall notices and medical news. Here's your host, Dr. Barry Prystowsky.
Hello and welcome to Courageous Doctors, the new show for you and your doctor. We're still on radio with the COVID, but hopefully that will come quickly to pass with the new coming of the vaccine, which is just coming out as we speak. But first, the overview. This new show, as you know, will cover the COVID, which we'll do first, and then we'll cover updates in government, Obamacare, healthcare. Then we'll talk about other healthcare news, and then we'll go into health and safety tips. So let's begin with the exciting news. The Federal Drug Administration, the FDA, has now approved emergency use of the first vaccine, Pfizer's, Moderna to follow. And in fact, England last week began giving the first vaccines. So it's an emergency use, and that means that it doesn't have official approval, which needs to wait for more research, but at least it has the initial approval to begin vaccinating, which hospitals are being prepared now to receive the vaccine for healthcare workers, and it will also be going to some of the pharmacies, to nursing homes, and to essential workers. And this is very exciting. Now, remember, just to review, that if you remember what happened with President Trump when he got the initial antibody injection in the White House before going to the hospital to get his remdesivir. Remdesivir is sort of like a Tamiflu. It kills the virus by preventing it from being produced in the cell and released. But the antibodies he got, Regeneron, and there's another company, Eli Lilly, that makes a similar one. Those antibodies, it's sort of like plasma from somebody that had the disease and got over it, where you inject the antibodies into the person. That's what a vaccine's like. That's what the Regeneron and Eli Lilly are like. They actually block the spike protein, which is the attachment side of the virus to get into our cells. So what the antibodies do is block that to prevent it from getting in. So the vaccine, like the antibodies, which, by the way, several hospitals around the state have these antibodies. So if somebody is exposed to the virus and test positive, you can get those antibodies like President Trump did and prevent even needing to go in the hospital, which is important now since our hospitals are filling up. We'll talk about that in a second. So the vaccines tell the body to produce these same antibodies so that we can then block the virus from getting into our cells. And the first vaccine, I think Pfizer and Moderna, will have to be given twice to build up enough of these antibody titers, so it takes time. The Pfizer's is given once and then repeated in 21 days. Moderna, I believe, in 30 days, 28 or 30 days. I believe Johnson & Johnson has a one-time dose that hasn't come out yet. Okay, so we're really excited about this. It's going to take many, many months to vaccinate the country, but I hear Moderna is going to have 200 million doses by the summer, and we'll start off like Pfizer, giving an initial 20 million doses each. So hopefully we'll get to that. Now, of course, I'm a pediatrician, so I'm excited about waiting for approval for the vaccine to be used for children. That has not been approved yet. We are getting workshops by our State Department of Health to prepare us for this. And that probably won't happen till close to the summer or late spring. What happened in the initial studies with Pfizer's is they did not test the shot on children or pregnant women. So we don't know how the FDA is going to eventually approve this, but we're excited. I believe Pfizer's will allow it for 16 years old and up, and Moderna is suggesting 12 years old and up. So we certainly can begin with certain ages, teenagers, to vaccinate, and hopefully all children by the summer. So again, remember, it's initially a two-step vaccination process. It takes a few weeks to build up these antibodies. It doesn't get in right away, like the shot that President Trump had, where either you get plasma or you get these antibodies from Regeneron or Eli Lilly injected. Those act immediately. When you vaccinate, it takes the body weeks to build up. So upon getting the vaccine, you still can get sick, so you want to still be careful. Okay, let's go to some other COVID news. So that was very exciting. This new show is happening as the vaccines are being rolled out. One last point about the vaccine. Dr. Fauci warned that since in England, apparently it did not happen during the initial phase 3 research trials, but when England opened up to the whole country to get vaccine, 2 people did have an allergic reaction, and they're not sure why it happened. They got over it quickly, but Dr. Fauci is recommending anybody that has severe allergies to anything, until we know exactly what caused these allergic reactions, should probably not be first in line to get these vaccines. But let's wait and see what the allergy from the vaccine actually caused in these 2 patients in Britain in order to make sure it's safe for everyone to get it. But anyway, the FDA approved it, so at least for people that don't have bad allergy reactions to vaccine products or food products, they'll certainly be starting with the vaccine for healthcare workers, essential workers, people in nursing homes, and people at high risk. And so we're started. Now, so let's just see where we are with the COVID. I'm going to speak about New Jersey. First to say that this horrifying pandemic, the worst since 100 years ago with the bird flu after World War I that wiped out millions of people, we're already up to over I think close to 300,000 people dying. And this is just a horror. We're living a nightmare. And that's why we're all still wearing masks and social distancing. And we're still in emergency control from our states. And therefore, because we're getting as bad now as we were back in the spring, there's a lot of restrictions in terms of where you can dine and eat out, whether you can go to nail salons and gyms. And each state has their own restrictions, but we're still in the middle of it. What are the exact numbers in Jersey hospitals? Well, we're not at the 8,000 hospitalizations we were in the spring, with over 1,600 in the ICU and many of those on vents. I believe 13 or 1,400, but we're getting there. We're about halfway there. So we're about halfway to the numbers where we were in the spring, but many hospitals are trying very hard not to admit, because they want to save the beds for those that really need it. And hopefully, if people that get sick until they can get the vaccine, if they can get these antibody injections, the Regeneron or Eli Lilly, then like President Trump, they may not even need to get, to be in the hospital. Let's see. This is interesting. Science magazine reported on the study from Mount Sinai Hospital in New York. This is a very good study where they actually measured titers of the vaccine. Most of us, myself included, have positive antibodies, meaning we probably had it maybe January, February when we didn't know about it, or later. Those antibodies just say that we have them, but they don't say how many. But and many of the studies that weren't really looking at there's many different antibodies to fight this disease. They weren't looking at maybe the ones that were absolutely protective. They were saying, well, they don't last that long. But Sinai proved that the ones that really protect us, the ones that we're making with this vaccine, actually do last 7 or 8 months. And I think I'm a proof of it, because if I had it myself in February and I drew my blood and had antibodies in September, these antibodies do last. So that's really a good sign. Hopefully soon our labs will begin actually measuring titers, especially now since we're going to be vaccinated. Like any other vaccine, when I do draw blood on somebody vaccinated for measles or mumps or, whooping cough or anything, chicken pox, I get a titer back from the lab that tells me if they're protected. So we hope to have that for this vaccine. And by the way, I neglected to mention that these new vaccines, the reason why they came out within 9 months thanks to President Trump and his White House team that pushed this vaccine that normally would take years, and the rest of the world working also with America, we were able to get it done quickly. That's because of the new technology that makes message RNA. Message is the message that the cell uses from the chromosomes to direct the cell to make proteins such as antibodies. And by injecting this message into us in a safe way to make not the virus, but the spike protein, which is what the virus uses to attach to cells, it allows us safely and more quickly not only to make the vaccine, but to build up these antibody protections to not let the vaccines attach. And remember to not let the virus attach. And remember that the reason why this is such a deadly virus is it attaches to our blood cells that go all over the body, so that when the body tries to fight it and it mounts a tremendous immune response, it ends up clotting up our blood vessels and destroying our lungs, kidneys, heart, even our brain. And the effects can last for many months, and even people that survive, even people that have very mild infections, you can still have effects. I myself didn't feel that my energy really came back really for most of the year, and a lot of us still have trouble where our mind is cloudy and things. So the immune response against the virus really causes a lot of the damage. And the benefit of having the antibodies from the vaccine is that if you fight the virus quickly enough, you don't have to mount such a strong immune response that you don't clot up your blood vessels. We call it vasculitis, where you get strokes and damage to body organs, so that you can get over it without really getting that sick. So let's see what else we have. The government, the CDC, changed a little bit on the risk of being exposed. Remember, initially back in the spring, they said if you're close to somebody for 15 minutes, and especially if you're unprotected, no mask, that you're likely to get the virus, a very contagious virus, more contagious than flu. Now they're saying that it can be less than 15 minutes, but if over a 24-hour period it adds up that contact was 15 minutes, you're still at risk. We know that children, although they're not as severely affected, can transmit it. And in fact, Newsweek showed that 2/3 of the children had symptoms before being tested, and that they can transmit it, although children under 10 or 11 don't seem to transmit it as easily. It's mostly coming from the teenagers now. In the spring, it was the adults that were dying, and that's why they're being very careful, and the nursing homes were at half the deaths. But now with this new wave, we're in the second wave, it's coming more from the young people, teenagers and young adults who are not careful and don't wear a mask. Let's see, the New York Times said that, we already mentioned that about the altered mental function. And, one last thing. Bloomberg News reported that college athletes, even if they're asymptomatic, you're hearing on the news every day that sports teams or games are being canceled at pro and collegiate level, high school level. What they found is these college athletes had MRIs of their heart and showed heart inflammation from this virus. Okay, let's see. Let's go on now and see what's in Obamacare. Government updates. We mentioned we're still in a state of emergency. President Trump, this is in Newsweek. So, fortunately, before he leaves office to President Biden, he was able to pass, he had to make it as a regulation because Congress is very slow to act, called the Most Favored Nations Rule. And this is just awesome, where Medicare, which has a lot of our drugs with the elderly, and hopefully it'll go to all of us, if a drug costs at a cheaper price anywhere in the world, the pharmacy companies cannot charge a Medicare patient more than that. And in fact, insurance companies, benefit managers, and insurance companies. Insurance companies hire benefit managers to sell their drugs, and these managers select which drugs they want to sell, therefore raising the price so they can get a kickback benefit. And Trump said, at least with Medicare, any kickbacks to the insurance company to lower the price of a drug have to be kicked back to lower the price also of a Medicare patient in the drugstore. And this is important because New York Times mentioned that Anthem and United Health and maybe others will no longer waive your copay or deductible this is for telehealth visits, but probably will become for drugs too. So that with insurance companies no longer giving us a break on copay and deductibles with the COVID, in this case for telehealth, but maybe for drugs too, so that at least for Medicare patients, if a price goes up on a drug, they patient whatever benefit was given to the insurance company to lower the cost, the patient's cost will be lowered. Two more really important things in government. Star Ledger says that New Jersey now has legalized marijuana. It's going to take a couple of years for Congress for the Assembly and the State Senate and the Department of Health to write the rules on how marijuana will be grown and dispersed to people that want it. But we always had it for medical reasons, but now it's for everybody. And MedPage today gave a warning that I was unaware of, that moms taking ibuprofen, which is like Motrin or Advil, there might be a risk to the fetus. So you may want to ask your obstetrician before you take any drug if you're pregnant.
Don't go away, there's more Courageous Doctors after these messages.
Hi, I'm Ingrid Burke.
And I'm Gina Unger.
Gina has known Dr. Berry in a professional and personal capacity for many years, and we are thrilled to be in his building. We are psychotherapists, and we offer mental health counseling for ages 12 and up. We do individual, couples, and family counseling. We're also excited to say that we have groups that we have for teenage boys and girls, for social skills, anger management, and self-esteem building. If you need to reach us,
check us out at lifeworksnj.com.
Our phone numbers are also listed on that website if you'd like to contact us. Thank you.
Thank you.
Wax Den is a full-body unisex studio. We specialize in hard wax, which is gentler on the skin. We do all types of waxing from head to toe. You can come in with your friends, so you have the moral support. We have hors d'oeuvres. You do have to have a minimum of 8 people for that party, and you would schedule that. Everybody's looking for a hand to hold and then someone to share the experience with, so you can look that up on our website. We have prenatal waxing. We take a little bit more time with the new moms, and a lot of people will schedule that once they hit their second trimester. We do have a waxing membership. It's set up just like a gym membership, and you come in just like you would go to the gym. It comes out automatically, and you just show up for your wax. We have several memberships for different services. We also have wax packages. The phone number is 973-542-8442. The website is www.thewaxden.com. We have 24-hour online booking.
Come to the Wax Den. We wax it all.
Courageous Doctors continues with Dr. Barry Prstyowsky.
All right, let's go on to other healthcare news. I know we're moving along a little more quickly today. A number of recalls. I'd like to start with recalls. CNN reminds us that we're still in trouble with metformin for certain manufacturers of it. That's a very, very popular diabetes drug. It had a cancer-causing agent in it, and so make sure that your metformin, if you're still on it, isn't one of those. ABC News talked about hedgehogs, bearded dragons. I'm not quite sure what that is, but it has salmonella poisoning. USA Today said that E. coli is now poisoned once again with romaine lettuce. We had that problem last year. And I believe they mentioned Tammy Mora and Antle as the company, so be careful with that. Just check with your store and see if the poison one was removed. Listeria, Fox News says listeria is in some sliced fruit and watermelon sold, I believe, at Walmart. So just check and make sure you didn't buy those. CNN says that plastic was found in green chili, Tucson chicken, and pork tamales. So I don't know, they found plastic in it. And Wegmans beef, nothing necessarily wrong with it. It just was not inspected at the port of entry. So be careful that you only get inspected beef. And there was allergens not listed in TEGTEEYIHJIA, spring roll, pastry, and beef and chicken samosa. So I'm not really sure what that is, but just be careful that you're not allergic to anything in it. Okay, let's see. A few more other interesting healthcare news. USA Today mentions that Long Island Sound in the water, people were getting sick from Vibrio thonificans. That's a flesh-eating bacteria. And Naegleria, which is an amoeba-like organism that there's no treatment for, had killed people in a small Texas city water system. And I know Texas was working on that, so my blessings to them. Fox News said that Acella, A-C-E-L-L-A, their thyroid medicine had the wrong dosage in pills. So just check with your pharmacist, make sure that was corrected. New York Times mentions that colorectal cancer screenings are starting earlier at 45 years. We've known this for a couple of years now. Just be careful. Check with your internist. If you're 45, you might need to get your colonoscopy or however they're looking to screen for cancer. Okay. Department of Health mentions, always gives a yearly update on rabies. It's basically been the same number of rabies cases in New Jersey over the last 4 years, obviously mostly raccoons, also skunk, fox, groundhogs, and even cats, but interestingly still not in dogs. So that's good. And Science Magazine, this is very interesting. Hackensack Hospital has a new drug for pancreatic cancer, and it works directly on stopping the cancer genes from being, multiplied. So that's always good news. Very scary pancreatic cancer. Okay, let's move on to health and safety tips. Let's see. New York Times, there's an FDA warning for Brazilian blowout hair straighteners that when you put it on your hair, it makes formaldehyde and you get poisoned with headaches, eye pain, nosebleeds, nausea, and trouble breathing. Wow, that's pretty bad. Let's see here in FoodNet, which is one of my favorite things to go to. Usually in my lectures with these, my newscasts, red kidney beans, I did not know this, are toxic when raw or even when slow cooked or even when only washed. But canned beans are safe because they're pre-cooked. So if you're doing red beans, a lot of us love it, you have to boil them to destroy the toxins. So what are these toxins? They're actually lectins, the same lectins that are found in all beans and peas and lentils and grains, but they're in a very, very high level in red beans, red kidney beans. And what the toxin does is it clumps up red blood cells, and that's bad. Okay, let's talk about a few fun things to end the show. FoodNet, again, expresses the benefits of eggs, being a good source of protein, 6 grams, along with vitamins and minerals, and just be careful with the egg yolk for the cholesterol. They remind us that ginger tea, which we all use, is good for nausea and colds, garlic for anti-inflammatory, and that plant-based meats, this was interesting. You know how you put eggs in your food to bind your meats together, like you're always mixing in eggs? They use as binders cellulose, pea oil, and mung bean, which of course has fiber and sodium, so you have to be careful. that you don't get too much fiber and sodium. But cellulose, pea oil, and mung bean will bind together the meats the same that eggs did. Of course, vegetable and fruits are always good for fibers and vitamins. And you have fiber in apples and avocados and cantaloupes, pears, mangoes, and bananas. And for those of you that don't want to be constipated with bananas, although I still eat one every day, avocados are very good with fiber and will also give you the same potassium as bananas. Of course, berries and grapes have their antioxidants and vitamins. Of course, broccoli, yogurt, and oranges as well. And I'll end with one good thing from Well and Good magazine. These are always fun. Those of us that are very busy, trying to get to work, working from home, get the kids onto their computers for virtual learning, they came up with 5-minute lunches. So if you're into salads, consider kale, chicken, salmon, and tofu and eggs. If you're into sandwiches, consider Mazola vegetables, consider spinach quesadillas, and consider veggie coconut wraps. Okay, thank you very much. Please stay safe. Hopefully we'll all get vaccinated soon. I hope to be with you again in the next month or two. Be well, be safe, and enjoy a wonderful holiday season.
Courageous Doctors, Pioneers and Heroes. Executive producers Barry S. Prystowsky, MD. And Patrick M. Marucki. Post-production Patrick M. Marucki. Makeup by Lisa McAllister, Salon Jimmy Gerards. Music provided by Video Blocks. Special thanks to American Medical Association and New England Journal of Medicine. Visit us on the internet at courageousdoctors.com.